Well, the province's annual vaccine campaign is rolling out today, encouraging residents to roll up their sleeves for a flu shot and a COVID-19 vaccine as well. Joining us to talk about the campaign is Ontario's Chief Medical Officer of Health, Dr. Kieran Moore. Kieran Moore, thank you so much for joining us.
Morning. Thanks for having me as well.
Yeah, first time in studio here. We've talked to you so many times throughout the pandemic, so it's nice to be able to chat with you in person. And we're talking on a day where this campaign has launched. Tell us about it.
Well, I'm really excited. We certainly want Ontarians to be best protected for the holiday and winter season through immunizations. So influenza vaccines as well as the updated COVID vaccine will be available to the general public starting today. I have my appointment booked at 1:35, and it was easy to go online, book the appointment at my local pharmacist. I know Toronto Public Health and the other surrounding health units have large clinics as well. So very excited to have the opportunity to best protect Ontarians going forward.
All right, and you're suggesting getting both at the same time. There is some concern. We even talked about it here. I know that when I get a flu shot, for example, I feel pretty out of it the next day. I know everybody's different, but getting both at the same time, do you think that will impact people a little bit more than it would normally?
Well, we do think it's safe and convenient for individuals to get them both at the same time. It certainly saves you time and effort going to your local immunizer. So that's one option. You can certainly separate them by any time frame, a week or 2 weeks if you'd like. The priority right now, given the amount of COVID activity, would be the updated XBB vaccine that's available. We're fortunate that influenza really hasn't started across Ontario, so you have a little time to get your influenza vaccine, but don't push it more than the next couple of weeks.
All right. And when you do get that vaccine, when you do get the flu shot, it does take how many weeks to really become effective?
It really takes 10 to 14 days before your immunity builds up. So right now it's so important. We have a narrow window before influenza starts to take off, which we anticipate being in the next several weeks, to get protected before the influenza season really starts.
Okay. When we talk about COVID in the community, I know anecdotally for me, I'm seeing it circulate a lot more than we did, of course, during the summer. Can you tell us where we stand right now when it comes to COVID?
We have certainly activity of COVID in every community across Ontario. The wastewater signal shows that it is continuing across Ontario. Hospitalizations are still in the hundreds of Ontarians needing medical care. So we need Ontarians to stay protected as we go indoors, as we go into more social settings over the next 6 months. So now, if you get immunized for XBB, for instance, you're protected all the way through to the spring. Normally the vaccines give you that level of protection, so it's a perfect time to get protected.
All right. And, we're thinking about last year. We know that there was a surge in RSV among children. We had the triple-demic with COVID and the flu as well added to that. And we saw a surge of children in hospital ERs. Can you tell us what preparations have been made, if any, to prevent that from happening again this year?
A terrific investment in improving pediatric care across the province. Our 5 major pediatric hospitals have received extra funding. They're operating additional clinics to be able to assess children, additional bed capacity across the sector. We've done simulations with all our health partners all summer long so that they can anticipate a surge in clinical cases in the pediatric population. We have a weekly meeting of all of the pediatric leadership, and that can accelerate to a daily meeting if we need to, if there's a rise in cases. RSV certainly has started. We have 100 individuals in hospital. Around 45 of them are children today. So we've prepared. I do think we'll be in a better position this year. We've also even worked with industry to make sure we have Tylenol and ibuprofen and outpatient antibiotics more accessible and available. And so industry understands when our surges will be so that they're available to parents and children.
All right, so we don't have that repeat of those empty shelves.
I certainly hope not.
Yeah, okay. Perfect. Dr. Kieran Moore, thank you so much for joining us. We're out of time here, but it's good to have you in studio here this morning. Appreciate it.
Thank you so much.